Have you ever noticed how some old ideas or fashions suddenly come back into style? Well, believe it or not, that can happen in medicine too. And right now, there's a lot of talk about an old heart medicine that may be making a comeback. More than 25 years ago, in the earlier days of my becoming a heart failure specialist, doctors studied a medicine called Digoxin. You might know it by the brand name Digoxin. It came from the foxglove plant, and it's been around for centuries. The big trial back then was called the Dig trial, and it found something important. Digoxin didn't help people with heart failure live longer, but it did help reduce hospital visits with heart failure. So, whilst it wasn't a miracle drug, it helped keep people out of hospital. Fast forward to today. At a big heart conference this year, doctors presented the results of a new study. This time, with a very similar medicine called Digitoxin. One advantage of Digitoxin over Digoxin is that it can be used more safely in patients with chronic kidney failure, as it's metabolized in the liver. And since chronic kidney disease is common amongst my patients, this is something that tends to limit its use. So, in this new study, researchers looked at over 1,000 patients with heart failure, most of whom were already on our best modern treatments, things like ACE inhibitors or ARNI, beta blockers, MRAs, and some on SGLT2 inhibitors. And here's what they found. People taking Digitoxin had fewer deaths and fewer hospital admissions combined compared to those on placebo or a sugar pill. So, what does that really mean? Well, think of your heart failure treatment as a car. You've got 4 big wheels carrying most of the load. Those are the 4 main proven treatments. Digitoxin may act like a spare tire or a booster. Not essential, but it might make the ride smoother and prevent breakdowns along the way. Now, it's important to keep this in perspective. The improvement was modest. It's not a miracle cure. The medicine studied, Digitoxin, isn't even currently available in Australia, unfortunately. And the trial still leaves us with questions. For example, will Digoxin, the drug we actually have here, give the same benefit? There's another big trial underway right now that will test that, and we'll know more in the next few years. So, does this mean you should be asking your doctor for Digoxin tomorrow? Not quite. The foundation of heart failure care is still the 4 key medicines that we know save lives and reduce hospitalizations. ACE inhibitors or ARNI, beta blockers, MRAs, and SGLT2s. If you're on those, then you're on the best proven medicine. But research like this reminds us that even older drugs may still have a role, especially for people who remain very symptomatic or struggle with low blood pressure that makes other drugs harder to tolerate. I love seeing these updates because they remind us that heart failure care is always moving forwards, sometimes with brand new therapies and sometimes by rediscovering the value of old ones. Medicine keeps moving forward, sometimes with exciting new drugs and sometimes rediscovering the old ones. Keep building on your foundation, stay engaged with your care, and know that your doctors are always looking for new and sometimes old ways to help you live longer, better, and with fewer trips to the hospital.